Welcome to Realizing Resilience, a podcast from the Connecticut Women's Consortium. We're not behavioral health professionals, but we're your gateway to real conversations with the experts. Each episode, we'll delve into the vast landscape of mental health, from personal stories to expert insights. Together, we'll bridge the gap between clinical expertise and personal experiences, connecting with diverse voices and perspectives. Join us for insightful conversations that demystify the world of mental health.
Dr. Lillian Gibson, PhD, is a licensed clinical psychologist, often referred to as a mood makeover expert. She is a highly recommended speaker, consultant, and clinician due to her advanced assessment and treatment skills. Dr. Gibson takes pride in combining her vocational rehabilitation counseling and clinical psychology expertise to help clients solve their problems through individual, group, or couples therapy for emotional healing and restoration. Her professional footprints include places such as Johns Hopkins and international research in South Africa. Dr. Gibson's resume also includes Gold Star interventions for anxiety, depression, trauma, insomnia, nightmares, and chronic medical conditions. She is a multi-HBCU graduate from Southern University and A&M College and Jackson State University. Dr. Gibson is passionate about highlighting the importance of diversity, equity, and inclusion within mental health services. All right, welcome back to Realizing Resilience. I'm Alana. Unfortunately, Marissa cannot be with us today, but regardless, I am so excited to be speaking with Dr. Lillian Gibson. So thank you so much for joining us, Dr. Gibson.
Hey there. Thanks so much for the invitation. I am excited to chat with you today.
So you are leading a training with us on imposter syndrome in the new year. Can you explain a little bit about what imposter syndrome is, who it affects, what its significance is?
Sure. So I'm pretty sure this day and age, most people have heard of the term imposter syndrome. For some folks, they think it is just this thing that happens when individuals are just feeling a little overwhelmed, maybe overthinking and engaging in a perfectionistic approach. But it really is much deeper than that as it relates to it impacting so many people. It does really show up with school age children. If we think a little bit about academic testing and comparison to peers, along with college students too, experience imposter syndrome, as well as professionals, individuals pivoting into different careers, imposter syndrome can show up. And what it is this thought or feeling as if one is not good enough or they don't have the skills or abilities to really do a task at hand. But with the training, we're going to dive much deeper into that, talking a little more about the burdens that are often associated with imposter syndrome and most importantly, how to overcome them.
When I think of imposter syndrome, for some reason, I only think of college students. I feel like because maybe for me, that was sort of when I started experiencing that. But I used to be a teacher, and with kids, absolutely, I feel like that's an area that goes overlooked.
Yes. And so, what most people don't really realize is that there can be these seeds planted, whether it be caregivers, parents, or educators, you know, with really wanting to encourage others to do really well, but it can manifest into imposter syndrome. So, yeah, kiddos can experience it. There's a ton of research that talks about imposter syndrome with college aged individuals. But then there's also a great deal of literature that really highlights that when individuals are in their careers in the early stages, because of workplace dynamics, that too can really result in imposter syndrome. And I've noticed too, with doing this particular research and working with adults, that even seasoned professionals, when they are transitioning into a new position or taking on new work related tasks, that they too can relate to imposter syndrome feelings and thoughts.
So your background is obviously extremely broad. One of the things, I love this phrase that you've been referred to as a mood makeover expert.
Yes.
So with that work and your clinical psychology background, how does that connect to imposter syndrome? Like what led you to pursuing this topic?
So life is all about a strategy. And when we talk about strategies, we are understanding the why. And of course, behavioral health experts like psychologists, clinical social workers and mental health counselors all want to be able to help individuals. And so for me personally, I take great pride and joy in strategically helping individuals develop a new norm. That's what we do as psychologists. We really dive into backgrounds, we really dive into what is happening in the here and now, and really put those puzzle pieces together for individuals so they can really ditch, activities, behaviors, and thoughts that create a great deal of distress and really develop new habits that really exude peace and satisfaction and feeling very confident. And so being a mood makeover expert is in alignment with this recreation because I feel we can always press our reset buttons. And that's the beauty of being a psychologist and working with individuals, creating new norms and really leaving behind different mindsets or thoughts that are more defeating as opposed to really creating this feeling of accomplishment. So it's definitely in alignment, and I take great pride and joy in that.
I think this is so interesting, and you're right that I feel like it's kind of a buzzword. Like everyone talks about
Mhm.
imposter syndrome all the time, but never
Yep.
really has kind of a clear definition. And so I
Yes.
think that idea of legitimate clinical interventions is really great and is going to be applicable to so many people.
You got it.
So, when you do training on imposter syndrome, what typically can participants expect?
Taking it a step further than what you talked about with that buzzword, we hear it, right? But we're going to develop what we identify as a definition, an operational definition of what imposter syndrome is. We're going to look at how those seeds can get planted. We are going to talk a little bit about burnout, and participants will do an activity just to assess their own level of burnout because I think we all can relate to that. But we're going to do an interactive exercise to just see where we are. And then really talk about the relationship between feeling overwhelmed, imposter syndrome. But as discussed earlier, as a psychologist, it's all about strategy. So we'll look at acceptance and commitment therapy and cognitive behavioral therapy as really helpful and powerful tools to decrease some of those activities and negative Nancy mindsets associated with imposter syndrome and folks feeling like they're not enough. So I'm really excited to share about that.
Could you share some advice for people who are experiencing imposter syndrome?
A tidbit in terms of a piece of advice is that individuals who are feeling as if they're managing or coping with imposter syndrome, you are not alone. That's the number one takeaway, that you're not alone. There is nothing wrong with you. If you're having those feelings, you can really relate to imposter syndrome. The thing is that there's a reason that one feels that way. And so being able to really identify, was it something that someone said? Was there negative criticism or comments that were made after something was turned in, or someone says that you should be, you could be, why aren't you? Those two are things to really recognize as a relates to the why. But considering that individuals are not alone, this is a very common experience. We too are going to talk about the advice of there is hope and that there are ways to really accomplish tasks without that imposter syndrome showing up. So, my advice is to really take great pride in who you are, a sense of ownership of things that you're committed to doing as it relates to school or work. Also, a side little tidbit is that imposter syndrome can show up in relationships. Imposter syndrome can show up when people are taking on new life changes and life roles, but despite where it comes from, there are tools and resources and places where folks can feel safe to develop their new norm. So those are my key takeaways in terms of advice. Folks don't have to suffer alone. There are options for help.
I love that. And what you said about being prideful, I think that's really important. People don't express enough gratitude for themselves
Yes.
or show enough pride for their own work. So
Exactly.
I think that's it. That was nice, short, and sweet.
Thank you so much.
Thank you. Take care. Links will be in the description to keep up with us at the Connecticut Women's Consortium and learn more about Dr. Gibson and her work. Thank you for joining us today, and see you next time.